And now we're going to segue into the release of a vision for child and family well-being, Georgia's Child Abuse and Neglect Prevention Plan. So this is the big launch that we've been talking about for a year, going forward with this. And again, we're about to put the link in the chat box for you all to go ahead and download it, and it will be sent out after this as well.
A Vision for Child and Family Wellbeing, Georgia's Child Abuse and Neglect Prevention Plan. So it started in 1993 with the release of Promises to Keep, Georgia's state child abuse prevention plan for that time. So both the 1993 plan and the 2020 plan aim to prevent child abuse and neglect at the individual, community, and state level. But we know that a lot has changed since 1993, over 27 years ago. So it was time to do an update, and we wanted to involve as much as community members and people across Georgia as we could. In summer 2019, 25 planning sessions took place across the 14 DFACS regions, 14 sessions with service providers and professionals, and another 11 sessions with parents, caregivers, local leaders, and community members. More than 635 individuals from across the state took part in these sessions, and at the same time, 2 surveys aimed at similar audiences were shared statewide in both physical and digital formats with over 801 survey participants. Using the statewide input, a team of representative leaders identified 6 strategic objectives to fulfill the vision that all Georgia's families should have equitable opportunities to grow and thrive in safe, stable, connected, and nurturing communities where they live, learn, work, and play. Those 6 objectives are to increase family economic stability, increase family resilience, increase access to early education, increase family mental and physical health, and to increase community knowledge and awareness of the societal factors that contribute to child maltreatment. The Georgia Essentials for Childhood Initiative Steering Committee will be charged with overseeing the implementation of the state plan, monitoring progress toward the plan's goals, assisting in the development of regional plans, and reviewing progress toward the plan on an annual basis. You can go ahead and download the plan right now at tinyurl.com/GACANPP. The Georgia Essentials for Childhood Initiative is a multidisciplinary partnership that proposes strategies to promote the types of relationships and environments that help children grow to be healthy and productive citizens so that they in turn can build stronger and safer families and communities for their children. It is comprised of a steering committee and partners who examine data, propose strategies and programs, advocate for policies, and build partnerships and general awareness. Georgia Essentials is led by Prevent Child Abuse Georgia, housed at Georgia State University, the Georgia Department of Public Health Injury Prevention Program, and the Georgia Division of Family and Children's Services Prevention and Community Support Section. Child abuse and neglect is not caused by a single factor, but by multiple factors related to the individual, family, community, and society at large. Many of our current practices and policies address the top of this tree, which are the more visible results of trauma and adversity, such as domestic violence, abuse and neglect, substance abuse, and maternal depression. The groundbreaking Adverse Childhood Experiences study has illustrated a link between early traumatic experiences, such as child abuse and neglect, and poor health outcomes in adults. Children exposed to abuse and other forms of trauma are at an increased risk of experiencing chronic disease, mental health challenges, and other adversities during adulthood. Child abuse impacts graduation rates, incarceration rates, job productivity, and a lot more as adults. Although we cannot ignore the immediate and dire needs facing issues listed in those leaves at the top of the diagram, we also need to expand our views of child abuse and neglect prevention to the roots in the soil, which are called adverse community experiences and adverse collective historical experiences. And these include lack of affordable and safe housing, community violence, systemic racism, and limited access to social and economic mobility. And all of these create additional conditions for vulnerability for child abuse and neglect to occur. Community environments and policies within the larger society are areas of opportunity for upstream prevention. The 6 strategic objectives take the input from those over 1,000 Georgians and what we know about the immediate needs of families and evidence-based upstream solutions in hopes of stopping the generational nature of abuse and trauma. The first objective is to increase family economic stability. Experts contend that it takes an income of twice the federal poverty level to provide for basic needs. Below that, 200% of the federal poverty level is considered low income, and for a family of 4, it is an annual income of about $50,000 a year or less. If we count the children in low-income households, we see that 49% of children in Georgia live in families whose income alone cannot provide for the basic and essential necessities. A national report found that children living in poverty had significantly higher rates of maltreatment. I want to be clear that there are many families subsisting in low income, but only a small minority abuse or neglect their children. The stress caused by poverty increases the risk of parenting difficulties and ability to meet the needs of children. When parents struggle to provide day-to-day necessities, they can feel anxious, depressed, fearful, and overwhelmed. The daily stress of living in harsh, deprived conditions can also have a disabling effect on parenting capabilities, resulting in inconsistent discipline, inability to respond to a child's emotional needs, or a failure to prevent or address potential risks to safety. Additionally, the higher rate of Black communities' exposure to and living in poverty, along with other inequities, contributes to disproportionate representation of Black children in the child welfare system, making this an issue of equity. In the plan, we have listed many objectives under increasing family economic stability. Just to share a few, we address affordable housing, small business development and support programs, family-friendly business policies, more options for higher education and technical training, along with reducing barriers and providing support to returning citizens. You can see the full list in the plan. Objective 2 is to increase family resilience. Before we get into more technical definition, I want to invite you guys to go to tinyurl.com/PCAGA Conference 1 on our discussion board and share what resilience means to you and how the families you serve have shown resilience, especially in these hard times. We would love to see that posted on the board, so please go to tinyurl.com/PCA Conference 1 or share it in the chat box now. Resiliency is the ability to bounce back or push through hard times. By building resilience in our communities and in each other, we can better protect vulnerable populations in normal times and in times of crisis like we're all experiencing right now. Resilience is a mix of innate characteristics, social and emotional competence, and connections developed through childhood and into adulthood. And it also depends on our social, environmental, and political surroundings. So here I have on the screen factors that contribute to resiliency on a societal level, a community level, like social supports and cohesion, housing, peer support, and then on an individual level, which can be nurturing relationships in childhood and as adults, material resources, personal outlook, that sense of control, and other physical and mental health needs met. But it also takes continual assessment of vulnerabilities and assessment of hazards, along with continual work to build equity and adaptive capacity. So it takes many things on many different levels to build resilience within families. So we just have a few listed in our plan, and I'm just going to present a couple of those today. One is to decrease family violence through the adoption and promotion of evidence-based practices and approaches, and at the individual level, increasing access to evidence-based programs for parenting supports and skills. Some community-level objectives are to promote access to broadband internet, technology for parents and caregivers to secure appropriate tools and resources. Broadband access is a huge one that we get right now with the pandemic occurring, and even in normal times, that's a huge need for families to be able to connect with resources. Additionally, promoting, linking, and supporting information and referral systems, which are also connecting families with essential resources. And then one more at the societal level would be to promote strategies to ensure families can quickly recover from natural disasters and public health crisis. So this is really ensuring all those safety net programs and resources are available to families on a routine basis so that they can be resilient and recover quickly from natural disasters. And yes, we actually did put this in here before the pandemic, so it's very timely that we have it in here now. And a more community individual level, expanding evidence-based after school, out of school, and also summer programs for kids. Objective 3 is to increase access to early childhood and education. Early childhood education is one of the most impactful opportunities for a child's foundation. Young children's brains develop quickly. During the critical window, their brains are making about 1 million connections per second, which means that nurturing developing brains is key to growth and learning success throughout the life course. The return on investment of high-quality early education is estimated to be between $4 and $9 per $1 invested. Parents, caregivers, and early educators who create a language-rich environment for children are key in fostering brain development and academic preparation. Parents with children enrolled in early care and education are less likely to miss time at work, more likely to earn more income to support the family, and to remain employed at higher rates. The availability of childcare in Georgia supports annual parent earnings of at least $24 billion, which definitely strengthens Georgia's family economic security. Yet in Georgia, access is a big issue. Here we see that about 364,000 children are income eligible for supports, such as funded slots through Head Start and also CAP subsidies. But over to the far right, we can see that there are only about 180,000 spots for kids in those income eligibility bracket to receive funded program slots or subsidies. This leaves about 184,000 income eligible children who cannot receive support because of limited capacity. And this is sad because Georgia is currently ranked 37th in the nation when it comes to education. We see that about half of our children, 3 to 4 years old, are not in pre-K. And this also leads to 65% of fourth graders who are not proficient in reading in our state. Studies that have followed children reared in poverty over decades found that those who had attended preschool have greater social emotional competence, higher graduation rates, higher rates of employment, and even reduced incarceration. So those are big outcomes we need to be looking for. But this really isn't just an issue of families who are experiencing poverty. This is an issue for everyone because the average annual cost per child per year is $8,000 in Georgia. So this is something that about every family is struggling with in Georgia. So
Hi everyone, it seems that the screen is blurry, so I'm just going to take it off really quickly and turn it back on. Hopefully that would do it. If not, we have a plan B, a plan C. So we'll get you in just 1 second. Okay, if you guys want to let me know.
businesses and understand. So some of the objectives we're going to go through today, and then again, the rest are in the full plan, are to develop and promote incentives for expanding childcare businesses in underserved communities, expanding eligibility to Georgia's Child Care and Parent Services, CAPS, which are subsidies, promote universal developmental screening and early intervention services, providing language nutrition coaching and training for workforce and groups that interact with caregivers and babies, shaping social norms about the positive lifelong impact of early childhood education, and lastly, supporting elementary schools and accessing pre-K slots in communities with limited infrastructure for early childhood education. Our fourth objective is to increase family mental health. Mental health and behavioral health challenges influences family stability and safety, work productivity, healthcare spendings, and violence victimization. And although Georgia ranks really at the bottom in the nation for mental health care, we have made some strides. Georgia has some great initiatives in regards to suicide prevention, youth mental health first aid, and more. We need to continue on this path to improve the mental health status of our whole state. So here are just some objectives. To ensure specialty accountability courts emphasizing behavioral health and treatment for all families, implementing evidence-based practices to reduce opioid addiction, increasing access to low-cost, widely available options such as telehealth and web-based services, strengthening caregiver-child attachment relationships through programs like home visiting. Ensuring medical co-payments and insurance companies are not barriers to treatment, providing resilience strategies for children and youth, and requiring social and emotional learning curriculums in schools. And lastly, promoting trauma-informed training for schools and all youth-serving programs, like trauma-informed care, those addressing implicit bias and empathy. And again, you can see and download the plan for the full list. Objective 5 is to increase family physical health. In Georgia, we're currently ranked 46th in the nation when it comes to health, so that's pretty near the bottom. So I have some statistics over to the left that kind of describe that, point out some inequities, and of course the 7% of children who do not have health insurance, that's 217,000 kids. But we know that ongoing care in a relationship with a primary care doctor can reduce both the harms caused by maltreatment and reduce the risk of future maltreatment. Increasing healthcare coverage improves one's abilities to sustain meaningful employment and return to work faster after illness. This creates a healthy, productive workforce and really reduces the reliance on social services. So here are some of the objectives that I'm going to lay out, and of course the rest are in the full plan you can download. So within the plan, we have expanding telemedicine services, which of course the pandemic has really expanded already, but keeping these going, promoting gun safety practices and policies, promoting policies and programs addressing food insecurities, using evidence-based models of sexual health education for school-aged children, expanding access to affordable health insurance coverage, and increasing prenatal support resources, especially for Black mothers facing inequities. Our sixth objective and final one is to increase community knowledge and awareness of the societal factors that contribute to child abuse and neglect, which we pretty much have really done a big job of today already. When people hear child abuse prevention, it is hard for them to think of anything beyond the actual abuse. So for them to kind of track backwards to what the prevention of it looks like. They may think parents are solely responsible, so telling parents to stop spanking or to make them stop being bad parents. People feel like it doesn't affect them, or it's more of an individual issue instead of a larger societal issue. Oh, that's a family matter. People also might not connect primary prevention methods such as helping parents find resources or creating more family-friendly work policies with the prevention of child maltreatment. And I promise you, whenever we ask this question on our trainings, how do you prevent child abuse and neglect, we never get family-friendly work policies or connecting families with resources. That's never an answer that we get from the greater community. And people also think that child abuse is a CPS or law enforcement problem to solve. Sometimes even that Child Protective Services as a primary prevention. We need to help them understand that while it's important to respond and help after it happens or while it's happening, it is equally important to focus on keep it from happening in the first place. And we need urgency for both. So here we have the objectives below. But we really need to be focusing on enhancing awareness about child abuse and neglect prevention, and understanding that means focusing on initiatives in the state like mandated reporter training, adverse childhood experiences awareness, and the initiatives Belonging for Hope and Strengthening Families Georgia's Protective Factors, which build resiliency. With a more thorough understanding that child abuse and neglect prevention means focusing on child and family well-being, so that's even before an instance of abuse or neglect occurs, these initiatives will be more effectively operating across disciplines. When service providers, policymakers, community leaders, and caregivers understand that child well-being and abuse prevention are the same goal, program adoption, implementation, and expansion can occur. Adapting public-facing messages about what causes child abuse and neglect and how far-reaching its consequences are can create space for important initiatives to work within all sectors in Georgia to create safe, stable, nurturing relationships and environments. We know that in Georgia, each community is very unique and should prioritize the development of prevention programs after evaluating existing services and identifying gaps. Each sector of the community has a role to play in developing a comprehensive program for child abuse prevention. In the plan, the objectives are also listed by sector, specifically looking at how you and your community can engage with this plan. To assist with the local application of the plan, the Georgia Essentials team is working to produce technical assistance around the plan and to identify counties across the state to work collaboratively with local organizations and stakeholders to implement strategies contained in the plan and in their communities. And again, you can download it and view all of the objectives at tinyurl.com/GACANPP.
And now we're going to have a word from the Director of the Georgia Division of Family and Children's Services, Tom Rawlings.
Hey, good morning, everybody. I don't know if you can see me or not. Everybody see me? I did turn on my, there we are. First of all, I just want to thank everybody who has participated in putting this plan together. PCA Georgia, of course, our fellow state agencies, certainly Voices for Georgia's Children, the Georgia Family Connection. It's amazing to me that we have gone all of this time without updating the plan. And so I was really pleased to see that we have not only spent a lot of time doing this carefully, we've also really, I think, y'all have done a wonderful job of getting together so many different groups and really putting together a thoughtful plan that will help us really navigate the world of child abuse prevention for the next 10 years. Just want to say that just echoing what you've already heard, child abuse prevention should be our goal. It is too often an amorphous goal. There are too often people who don't know, what can I do to prevent child abuse? But the truth of the matter is we all have a role to play in it, and everything that we can do to do such things as improve mental health, improve the ability of children and families to get access to quality child care, everything we can do to keep responsible adults looking out for children. Those are the kind of things that the concrete actions that we can all take. And I think it's especially important in this difficult age in which so many of our children are trying to go to school online or via Zoom, when families are under so much stress, when we have so many cultural issues we're addressing, and some of the detritus of our history in this country. I think it's so important that we put together a plan that we can all work on to make sure that our children are safe, stable, and thriving, and that we are creating the right kind of roots, not the roots of ACEs, but the roots of a thriving community that will produce those fruits of safe and stable and well-developed and successful children who can grow into good citizens. So thanks, everybody. I just wanted to hop on here for a second and thank you all for all the wonderful work you've done, not only putting together this conference and it's the continuing conference, but also, of course, in putting together this plan, and just very happy to launch it today. So thanks, everybody.
Thank you, Director Rawlings. And now if we can have our panelists make sure that they turn their videos on, and this will be moderated by Natalie Towns, who is the Director of the Prevention Sector, Prevention and Community Support Section at DFACS.
Good morning, everyone. First, I'd like to just take a second to thank Director Rawlings for his support and leadership throughout the development of the plan. It was integral to get that done, so thank you, Director Rawlings. Again, my name is Natalie Towns. I am the Director of the Prevention and Community Support section within the Georgia Department Division of Family and Children's Services. And we had the pleasure to partner with Prevent Child Abuse Georgia to facilitate the this plan. So I just want to thank Julia Neighbors, Joe Wash, Nasha McDowell for their partnership in doing that. It was truly a pleasure. And also our partners with Advantage Consulting, and also the rest of the team within the prevention section at DFACS, especially Deborah Chosewood. For her leadership throughout the development of the plan. And probably most rewarding for us, just being able to travel around the state and get the feedback and get the input from the thousands of Georgians, the stakeholders, the providers, the parents, the community members, to hear what they had to say on what the state needed to build a successful child and family well-being system. And finally, I wanted to thank also all of the state leaders who were committed to, again, our state having that comprehensive child and family well-being system. And so we are pleased to have some of those leaders who were involved in this effort from the start to participate on this panel. And so what I'm going to do is I'm going to ask you all to introduce yourself in 2 minutes, and also tell us, how does your organization help families thrive, especially through prevention? So I'll start with Cheryl Benefield. And again, in 2 minutes, if you would introduce yourself and also tell us, how does your organization help families thrive, especially through prevention?
Good morning, and thank you so much for having me. My name is Cheryl Benefield, and I'm the Mental Health and Wellbeing Coordinator at Georgia Department of Education. For a long time, the department has been moving toward a whole child focus, really looking at the many factors that impact our children and youth. On August 1st, the Office of the Whole Child, which had been in place for a little bit, was actually formalized, and we now work together. I there am the Mental Health and Wellbeing Coordinator, but we also have someone who is over integrated wellness, and we brought school safety over to the office as well. So there we look at all of those things that help families and that are preventative for what our children are experiencing. This office helps to consolidate the work that was done previously in the Office of School Safety and Climate and in other areas around the department. Dr. Merrick really resonated with me this morning. Prevention in education has often been intervention, responding to children in crisis, and oftentimes those children are in families that are in crisis. So by consolidating our efforts at the department, we're moving everything upstream. We're looking at primary prevention and how do we start really supporting preventing some of the behaviors and some of the activities that happen with our students that turn into risk factors and risk behaviors. We're focusing on resilience and protective factors and really strengthening our partnerships with Prevent Child Abuse Georgia, the Office of the Child Advocate, Strengthening Families Georgia, and so many of our partners and our sister agencies. We work closely with our Family Engagement Unit there at the department to provide prevention resources and content to help our schools interact with parents in these upstream spaces.
Thank you. Next, I'll go to Ms. Janine Galloway. Janine, again, if you could please introduce yourself and again in 2 minutes, tell us how your organization helps families thrive, especially through prevention.
Yes, good morning, everyone. Janine Galloway, Maternal and Child Health Director at the Department of Public Health. I first would like to bring greetings from our Commissioner and State Public Health Officer, Dr. Kathleen Toomey. Just want to say quickly hello to Carol Steele. It was great seeing her face and hearing from her today. And congratulations to the awardee, Mr. Ernest. We worked with him on implementing home visiting in Athens, so congratulations to him. So in public health, specifically in maternal and child health, we are making a really concerted effort to support the whole family. And we do this through our programs, our early intervention programs, such as Babies Can't Wait, children's medical services, especially home visiting and Healthy Start. We also have a new initiative which is focused on our dads, which is our fatherhood initiative, because in many times in MCH, we are solely focused on the mom and the child, and we forget about the dad, and they are just as important in improving the maternal and infant health of our families. We are also excited to start weaving the Strengthening Families Protective Factors into framework into all of our programs in MCH. And we have a couple of trainers that have been trained in that framework as well, a couple of staff. And then lastly, we know we can't do this alone, and we work really hard to expand our partnerships externally and internally, and really work with our community organizations to increase our reach and expand prevention. We have a great partnership again with external and internal, such as our injury prevention team, which I know Lisa is on as well to represent the agency. So thank you again for this time.
Thank you. Director Rawlings.
Let me unmute myself, sorry. Good morning, everybody. I think at DFACS, we are really, I think, privileged to be sort of the federal center almost of funding for prevention. But it's not something that we do alone. I think there are two real key components for us. Number one is the work, Natalie, that your section does, and certainly in partnership with all of the others here, Janine, Lisa, Amy, Dante, everybody, in terms of our Essentials for Children and our Strengthening Families Georgia partnership with about, we got 50 different organizations. That's part of it. The other part, I think, of course, is in the work that we do in our Office of Family Independence, which is extremely important right now. I think we don't do enough in highlighting the work that we do in terms of getting folks Medicaid, Peach Care, food stamps, and now, of course, the PEBT program for folks who are not getting school lunches when schools were closed down. How much that really helps our children and families avoid the stressors, the financial stressors that can lead to really a chronic neglect, can lead to abuse, can lead to family violence, and can lead to other ACEs that we have talked about this morning. So it's really, I think Dr. Merrick said it well, and I think a number of other people have said the same thing today, which is that our role as an agency is really not simply to respond to issues of child abuse and neglect. We really have an obligation to do all that we can to strengthen the family's ability to thrive, so that parents can have thriving children, and whenever possible, of course, so that extended family members can step in and help children and help avoid issues of child abuse and neglect. And I think one of the best things I heard this morning was that we need not mandated reporters, but mandated supporters. And I think that's literally what we are creating through our prevention work. So very glad to be with y'all to support that today. Thanks.
Thank you. Commissioner Jacobs.
Thank you, and good morning, everyone. Thank you for having me on the panel. I am the Commissioner of the Department of Early Care and Learning. We're the state's birth to 5 early learning agency, probably best known for Georgia's pre-K program, which educates 80,000 4-year-olds every year. But we also license childcare. We administer the childcare subsidy program in Georgia and several USDA nutrition programs that helps to feed over 80 million young children in childcare every year. So I think that's an important part of helping families thrive with that nutrition piece. But I have to say, I think the most important piece that we play in this is ensuring access to quality, healthy, and safe childcare throughout the state. We do license, monitor, and regulate over 4,500 childcare programs throughout the state. That's in 156 counties. There are just a few counties that do not have any licensed childcare. And that can be either in a center-based program or even in a family childcare learning home. We also focus on the quality of that childcare, so really integrating the early education component, which we know is so important for optimal brain development for setting that solid foundation for future success. It was already mentioned in the previous presentation how important that is on a child's brain development, and how children who have access to quality early learning are more likely to graduate from high school, continue on to college and career, likely to earn higher wages, and less likely to need public benefits or even be part of the criminal justice system. As part of that quality, we support teachers in these programs so that they are equipped and trained to value inclusion in those programs, so children under all ability levels. Also prioritizing the development of their social and emotional skills for young children, and even work with children with challenging behaviors, which when you have children, very young children that are in the presence of these teachers and caregivers for sometimes 12 hours a day, 5 days a week, they can identify any type of developmental issues very early and get them referred to services, of course, for best results. And then, of course, a big part of that, which was mentioned, how expensive childcare is, we do provide financial access through our CAPS program, which is our child care subsidy program, which allows to provide scholarships for 50,000 children to have access to childcare. And they've even increased the focus around families for the subsidy program. It's not just about providing with that scholarship and that financial assistance, but also helping them with other services that they may need to be successful. So thank you very much.
Thank you. Mr. Dante McKay.
Hi, good afternoon. My name is Dante McKay. I'm Director of the Office of Children, Young Adults, and Families in Behavioral Health Division at the Department of Behavioral Health and Developmental Disabilities. Quite a long title. I bring greetings this morning on behalf of Commissioner Judy Fitzgerald and the Director of the Behavioral Health Division, Monica Johnson. One of the messages that resonated with me this morning is that it takes all of us. No one agency, office, or group can do it alone. And so in that way we work, my office works within the agency and across child serving agencies. And so just a brief review of some of the things that we do. DBHDD for short provides community-based services through a contracted provider network. We serve individuals who have mental health challenges, developmental disabilities, and substance use disorders. As Georgia's public safety net, our primary responsibility is to serve individuals who are uninsured or who have Medicaid. The office is, or the agency is divided into 5 divisions in the Office of the Commissioner. I will highlight 2 for this group, the Behavioral Health Division, where my office is, and the Division of Intellectual and Developmental Disabilities. Within the Behavioral Health Division, there are 9 offices, and that work overlaps, again, within the agency and outside of the agency. But the 9 are regional operations, crisis coordination, adult mental health, children, youth, and families, addictive diseases, deaf services, recovery transformation, supportive housing, and behavioral health prevention and federal grants. Within my office, the Office of Children, Young Adults, and Families, there are 5 practice areas: programs, clinical, workforce development, system of care, and peer support / lived experience. And then in terms of how we work within the office and across offices, we organize our services and supports along the care continuum. And there are 4 sub-continuums, and then there are services that span the continuum. And so just to briefly give examples of those. The first is prevention early screening. An example would be coordination with the Georgia Academy of Pediatrics. Early intervention, there we have a statewide school-based mental health program. Intervention, again, school-based mental health and first episode psychosis. Late intervention, that is our inpatient residential work we do with providers. And then an example of service that spans the full continuum would be parent and youth peer support. So good to be with you this morning. Thank you.
Thank you. And Ms. Lisa Dawson.
Hi, good morning. My name is Lisa Dawson. I'm here, so pleased to be here with my colleague Janine Galloway from MCH, representing our commissioner and Georgia Public Health. I'm the director for the Injury Prevention Program. I'm also honored to serve as a member of the PCA Georgia board. really our injury prevention program has really grown out of primary prevention. Prevention of injuries such as those sustained in motor vehicle crashes, fires, unsafe sleep environments, falls, other types of unintentional injuries. And then we have done some intentional injury work, which is where our ACEs work sits. But this is how we help families thrive, is by helping to prevent those injuries in the first place. We have been and are only able to do this work because of our partners. Quite a few who are on here today. Thank you, Director Tom Rawlings, for your support over the years, and MCH as well, and so many others, too many to name. We really feel like the public health approach is transferable to child abuse and neglect. One of the demonstrable examples of this work has been the Essentials for Childhood work that has been going on for 7 years. This work with so many partner contributions really laid the foundation for the recent award of a competitive prevention of ACEs data to action grant. So just really appreciate the opportunity to be here and the invitation to the panel.
Thank you. So I am going to ask another question for all of you all to answer. And that question is, what current work or first steps is your organization taking to address the inequitable outcomes in health, education, and access to services many Georgia families face? Again, I'll repeat that question again, and I'll start back with Ms. Cheryl Benefield. What current work or first steps is your organization taking to address equitable outcomes in health, education, and access to services many Georgia families face? Cheryl?
So most immediately, we pivoted to supporting schools and districts as they implement multiple modalities of instruction, from hybrid to face-to-face to virtual. So that's been a huge focus. We've also applied for waivers from the federal government for many of the required testing components and other things that would typically be administered during a school year, and are currently working at the state level to see what else we can do to support that. Beyond that, at the whole child level, we are absolutely focusing on supporting access to healthcare, mental health care, and increasing the number of school nurses and school-based health centers.
Thank you. Ms. Janine Galloway, I'll let you respond next.
Sure. One, I would like to start off by saying that at the Department of Public Health, and specifically in MCH, we utilize data to help us determine where programs are needed. And so for an example of that is through our Title V block grant, which is not just a funding stream, but it's an opportunity for us to do a needs assessment. We do that every 5 years. We just completed our 5-year needs assessment. And that is an opportunity for us to analyze what the needs are of our community and of our state, and help us to determine our priorities and where we put programs, so that we make sure also that we are equitable and we distribute based on the need of the community. And we also do this with our home visiting program, and when we determined where we were going to select Healthy Start sites as well, is utilizing that data. And then second, I'd like to mention that through our councils and our stakeholder meetings, like right now we have a maternal and child health advisory council, which Elise and I were double booked, but happy to be here. We left that meeting to come here, but through that, we really work hard to be inclusive and have our members represent the state. So whether that is from ethnically diverse backgrounds, education levels, your family, your representative of our families, your parent, our children and youth with special health care needs is represented. Also having adolescents be a part of that work too, that's impacting the communities we serve. And then fatherhood also was another way of us focusing in on a special group and really making sure, a lot of our work can be implemented across many different communities, but it also, we have to be put special consideration into working with specific communities that are being impacted disproportionately and are not necessarily receiving the services that they need to improve. And so we do that again by having strategies that impact the whole state, and then also having strategies that are focused in on those particular communities, especially through Healthy Start, home visiting, where we focus on at-risk moms and families, and those that are at risk for poor maternal and birth outcomes, and then looking at our fathers as well. And so again, utilizing our data to make that impact and to determine where programs are needed, and then also making sure our community partnerships, our councils, our stakeholders are representative of our community and are diverse.
Thank you. Director Rawlings.
All right. I won't repeat what Ms. Galloway said because we are really excited to be partnering with them on a lot of these home visiting programs as well. But I want to emphasize a couple of points. Number one is we are really trying to help be a partner in building the network of community-based organizations that can help families deal with issues of food insecurity, issues of mental health in schools, issues of just family needs. So the thing we've done the last couple of years, and Dahlia Bell Brown, who I think is still on here, just left us for the Woodruff Foundation, but she and her team were very instrumental in building our State of Hope program, in which we have over the last couple of years been able to invite organizations and folks with great ideas about what they can do in their communities in terms of education, food security, trauma, dealing with issues of trauma, and how we can build small organizations in each community that can address these needs on the front end before our child protection element has to become involved. And I think we have funded now, I don't know, many sites. We've also got well over 100 in our ecosystem now. And each year we're going to continue to invite more organizations to join. One of the things that we've done recently that I was really excited about is making sure that we are reaching out to communities in an equitable way. So we just worked with Sarah Familia up in Gwinnett County to open the first cafe, which is the Centro de Ayuda Familiar y Económico. It's basically a family support center where folks can come in there and get information about services that they may need, whether it's housing or education or childcare or therapy or anything else. So it's our opportunity, I think, as an agency to not necessarily build these things ourselves, not to make it all about the government, but to really partner with organizations, with churches, with individuals who have bright ideas about and help them to build that community network of support for families so that the government does not have to become involved in the family's life, and that we can be a supportive system for the family and the extended family, as opposed to being the fixer of all problems after the fact. So thanks.
Thank you. Commissioner Jacobs?
Well, I want to focus just on 3 initiatives to try to address your question. One is a policy decision we made several years ago that in order for child care programs to continue to serve children that are on our subsidy program, they must be quality rated. Quality rated is our assessment of quality in child care, where you receive a 1, 2, or 3 star based on that early education component. And we set that goal so that you had to be quality rated by December 31st of 2020. Well, obviously, we've had to change that and extend it to 2021, but we did that because we know quality is important for all young children, but it's even more important and more beneficial for children who come from low-income families. And so although we've had to extend that goal to December of 2021, we're continuing to make progress. And the good news is 82% of children who receive our CAPS program, our subsidy program, are in quality rated child care programs. So that is good news. We've also, in the last several years, increased our focus on 2-generation practices so that we can support both the child and the adult in the family at the same time. We do that specifically through our CAPS Family Support Unit, using family-centered coaching, and are focused right now on how do we connect families to other resources that they need to assist with economic stability and success specifically. And I would say the most successful part of that is our partnership with the Technical College System of Georgia, where we know they have many, many student parents that not need access to childcare, which can be a barrier to them completing that degree. And so we can provide them with access to those resources, but we can also connect our families or the CAPS families with TCSG, which is such an available education resource throughout their state and affordable. And then most recently, just as September 1st, we know that there are many school systems that are in virtual learning mode, and we also are concerned about parents managing that while trying to work. Many of them obviously have to work outside of the home. And so Governor Kemp asked us to come up with a solution for that. And so we created the SOLVE program, which stands for Supporting On-Site Learning for Virtual Education, which provides financial assistance to these families so they can provide a safe and supportive environment in childcare while their student is engaged in virtual learning, while the parent works outside of the home, and we're able to provide financial scholarships for that. And we have about $19 million to do that. And so that's a new program. And for those of you who are listening, we have a lot of information on our website. And if you can help us get that information out, because we want to provide families that support, that need that financial support. They were not expecting to pay for any type of care during the day, obviously, but we know that they need that drastically. So if you can help us spread the word on that, we would appreciate it. Thank you.
Thank you. Mr. Dante McKay.
Thank you. In my opening remarks, I mentioned system of care. System of care, there's a lot of layers to it. So there is the programming, but it also is a philosophy. And so some guiding principles that kind of drive that work. System of care is a spectrum of effective community-based services and supports that is organized into a coordinated network. It builds meaningful partnerships with children and families, and it addresses their cultural and linguistic needs. And so applying that, working with our sister agencies, interested partners and stakeholders, families and youth, we invite folks to coordinate in many different ways. And we, some work products that come outside of system of care, the philosophy is a system of care state plan. We're required by Georgia law to have one. We just wrapped up a 3-year plan, and the new 3-year plan started as of July the 1st. It is designed to complement the Child Abuse and Prevention and Neglect Prevention Plan and other plans that serve children and families. And it was informed by all of Georgia's child serving agencies, managed care organizations, Children's Healthcare of Atlanta, provider associations, advocacy, family and youth-run organizations, and nonprofits. And the other is training. We see our role in coordinating with our partners on training. And so in the last week of August, we just held our 13th annual System of Care Academy, which is inclusive of agencies and youth and families and professionals and so on and so forth. Due to COVID, similar to this conference, we bring together about 500 individuals every year, but this year we pivoted to an online conference. And so those are the ways that we work, with our partners to serve children and families and reduce outcomes. Thank you.
Thank you. So again, I'd like to thank you all for serving on our panel. And again, thank you for your commitment to staying involved and developing